Most probably you are muted. Please unmute.
রুমি শোনা যাচ্ছে এখন আমাকে?
Yes.
Yes, you can hear. আসসালামু আলাইকুম স্যার।
আমি ভালো আছো?
জি স্যার, অনেকদিন পরে দেখলাম স্যার আপনাকে। কেমন আছেন?
জি ভালো আছে। জি আসসালামু আলাইকুম আমির সাহেব।
জি স্যার, কেমন আছেন? আপনাকেও তো
আলহামদুলিল্লাহ অনেক ভালো আছি।
3 মাস পরে জি কথা হয়েছে অবশ্য, কিন্তু আর দেখা হয় নাই।
ফোনে কথা হয়েছে।
ইনশাআল্লাহ। জি জি ইনশাআল্লাহ। ভালো আছেন না?
জি আলহামদুলিল্লাহ ভালো আছি।
তো বাকি গেস্টরা জয়েন করার আগে স্যার আপনার সাথে নিশ্চয় রুমি কথা বলেছে এই মিটিংটার ব্যাপারে। তো আপনারই ফেলো ডিফিল 3 জন আছে আপনার অক্সফোর্ড থেকে। লেটেস্ট পিএইচডি করলো আপনার মহসিন বাদাত, যে আপনার জিন এডিট করলো, ই বিটা থ্যালাসেমিয়ার জিন কারেকশন করলো আর কি। হোপফুলি উইল হ্যাভ এ কিউর ফর ই বিটা থ্যালাসেমিয়া ইন দ্য ওয়ার্ল্ড, হোপফুলি. So he just completed his PhD 2 months ago, and that published in Nature as well. So hopefully he will be connected and he will physically come to visit your center on 7th of November, inshallah. The other person is Josh Wright, who is the president of the British Society of Hematology. He has sent his apology because he's got a crisis, so he will not be joining. Professor David Roberts from Oxford University. He is quite interesting, you see, because he has done lots of work for malaria and a global leader on the global hematology part of it. He's also the National Director for the National Health Services Blood and Transplant. So he will be connecting. And we have Professor Paul Telfer, one of the leading authorities in the world for sickle cell and thalassemia. From Queen Mary University of London, and he's a consultant colleague of mine in BARDEM, so he'll be connected as well. And obviously, you are here, Professor Romans are here, and then we will have director from the BARDEM and other colleagues. Dikta, I think, is also connecting. So hopefully, the idea of this face-to-face meeting is, when we will be out in Dhaka on 7th, how best we can integrate, come together and discuss and see the options of collaboration and getting to know from each other how best we can collaborate between your institutions and the NHS blood and transplant and other services as well. Because with me, there will be about 17 professors coming to Bangladesh from Europe and mainly from the United Kingdom. And they are the leader in their own specialty, including cytogenetics, immunophenotyping, PET CT scan, radiology, etc., radiotherapy. And I think it will be a good opportunity for us to show them around what we do with hurdles on the ground and how we can collaborate and work as a team. So that's the basis of this face-to-face meeting this morning and this afternoon in Bangladesh. Please now. Yeah, I'm in a meeting at the moment. If you have anything else, then speak to my registrar. Oh, yeah, that will be a bit long meeting. So, what it is regarding? Hmm. Mm-hmm. Mm-hmm. So no, so antidote you see you have now for the apixaban, rivaroxaban as well, because we have andexanate alpha. But if you want to give dabigatran, we have molecules to reverse as well with this hydrosuzumab, as you know. So I don't mind, you can give either.
Yeah.
But sorry about this, sir. Sir, is there any update about your proposed BADAS Cancer Hospital?
BADAS Cancer Hospital will take time because it's such a big project. I don't think we can enter on it without help from the government. The government wouldn't take any move before the next election, so sometime in January, within January. So we shall move after that.
Okay.
But like we can start things like treatment of hematological malignancy, things like that.
Yeah, that's really good, sir. Rumi was telling me, I think the last week he had one leukemia, one testicular lymphoma as well, and I think it would be quite good to get them some facilities probably where people know that these are the hematological bed, for example. I don't know whether you have one or not. So getting to know people that intensive things can be done, and eventually we expand. And I think I talked to various people. You see these the hematological issues and etc. And there are lots of patients there with Burkitt's lymphoma, high-grade lymphomas, leukemia, CNS lymphomas as well. So I don't think there is any deficiency of the patient. It's just the getting to the facility and people get to know that what we can do within BIHS, for example, because Rumi is here and he has very good experience and very good patients advocate as well, I have to confess.
It is already joined.
Dipta sub to join.
BARDEM ডিজি তো চেয়ার করতেছে একটা সেশনে।
I think I will be quite interested to take whole of the team because in Dhaka, because the main meeting, the conference is in Sylhet, in association with Royal College of Pathologists and Sylhet Usmani Medical College Hospital. I think I'm quite interested to take all the experts. I know they will be subdivided. For example, David will be going to your institution with Paul Telfar and Mohsin. Others will go to the cancer hospital and others. But if possible, I would quite like them, all of them, to visit your institution, probably BIHS or BARDEM, whichever is closer where they stay. So in future, when you go for this venture of BADAS Cancer Hospital, I think you can collaborate with them as well. I think because they're quite good, you see, because they have international experience. All of them has as well in terms of collaborating with various countries. The radiologist guy who is from Singapore actually, he's a very young, enthusiastic Jonathan Moore. He's one of the leading experts on expansion, helping out, and the protocol guidelines. So he will be down there as well. Yeah.
If we get a proposal for starting treatment of things like lymphoma or leukemia, then we should start.
Okay, sir. This is for your kind information that within last 1 year, 1.5 years, we already treated acute myeloid leukemia, acute lymphoblastic leukemia, and follicular lymphoma, multiple myeloma as well. These all cases diagnosed independently by this hospital under the Department of Hematology, and we successfully treated these cases And still now, that patient communicating with us, that means we are happy for these things, that they are satisfied most probably, so that they are communicated with us. So just I want to mention that this hospital capable to handle this kind of patient, to treat this kind of patient. Now we should look forward actually.
In that case, my suggestion will be first it's not that the patient satisfied. Also, you
Yes, sir.
satisfied that you are up to date on this thing.
Yes, sir. Though we have no bed capacity, neutropenic zone for this patient, but with the special help of our DGSR and other supportive staffs or sectors from this hospital, they arranged a cabin and we made that area as a neutropenic zone, and we taught the nurses, staffs, and other supportive agents for neutropenic care patient. And by the help of that sectors, we successfully treated the patient according to protocol. This doesn't mean that we just give treatment and suddenly this patient receives a good outcome. Actually, we followed protocol, and with the following protocol, we give successful treatment actually. But last week, actually, we lost one patient. We had to refer that patient to Dhaka Medical College Hospital. Recently diagnosed from this hospital, flow cytometry, acute myeloid leukemia, but due to dengue condition, there is no scope to handle this kind of patient. So to minimize the patient sufferings, mortality, we just referred. One case, testicular lymphoma as well, we failed to give treatment because it's still now no facility due to dengue season. But I think within last 1 month, dengue season improved, and after that we can reschedule or reshuffling our capacity.
I mean, my suggestion would be you work out what you can do, and individual within financial means, financial, you will organize it. I can tell you, let's say, I should be able to raise a fund about, or let's say, 40 crore, and then back on start the unit.
Okay. So already David Roberts connected.
Thank you, sir. Thank you for your help on that aspects, and I'm pretty sure we can help Rumi on the ground. And you have transfusion unit now. You can do the apheresis. I was talking to Professor David Roberts. Within such a short period of time, you are now able to do the apheresis. You have single donor. You can separate platelets, fresh frozen plasma. It's a great achievement. I wonder whether we will be able to do it in a new facility, even in NHS. So I think this is a really good outcome, and we all should help Rumi to build up initially the hematology service in your facilities. Thank you. Dave Roberts from Oxford University. Dave, good morning, Dave.
Hi.
Good morning and good afternoon.
Thank you, Dave, for joining in. We have Professor Azad Khan. I think you met, he's our national professor and the chairman of the BADAS authority. I think you met him some times ago, as we discussed before. And we have the BIHS Director General Fazlur Mansar here, and the gentleman sitting on the front with beard, he is Rumi, Dr. Rumi, Shahidul Islam Shikhar, who actually was here with me for a few weeks and has quite lots of experiences in UK and also on the ground in Bangladesh. He worked in a transplant unit there as well. So he is on board to expand the service in terms of transfusion service, hemato-oncology, as well as thalassemia and so on. And I get a feeling that the authority on the ground is very supportive of this project and so on. We have Professor Paul Telfer from the Parts Health and the Queen Mary University of London. Good morning, Professor Telfer.
Hello. Good morning and good afternoon.
Good afternoon. We have Paul, Professor Azad Khan, our national professor, as you know, and you met him before. BARDEM. He is kindly made time and he is physically attending. And we have Professor Fazlur Rahman sir, who is the Director General of the Bangladesh Institute of Health Science and General Hospital in Dhaka. And Rumi in front of us is the hematologist assistant professor there. And we will have other participants. We'll have Shahriar Mohammad Sadek, who is a colorectal surgeon. He was actually Paul in Royal London with Mr. Shafi Ahmed's team in colorectal a few years in Barcelona. You will probably know him. And then we are expected to have Professor M.K. Qayyum Chowdhury, Director General of the BARDEM. And we are going to have Sabrina Rahman, Junior Consultant, Department of Transfusion Medicine. Mr. Sadek, I mentioned. Yes, yes. And we will have Professor Shaukat Hussain, Director of the Laboratory Sciences in BARDEM, and Tasneem Farhana Dipta, whom you met in Dhaka, who is the head of transfusion medicine in BARDEM General Hospital, and you know her. Yes. Thank you, Dipta. And Farida Parveen, Assistant Professor Transfusion Medicine. I also invited Mohsin Badat, who just completed his PhD from Oxford University on gene editing, E-beta thalassemia, direct correction. He probably will be joining in from Greater Mosque Children's Hospital later this morning. With all this, I think with the permission, I think we should start the discussion. And Dr. Rumi, with the permission of Professor Azad Khan, I think you can start.
Thank you. I am Dr. Mohammad Shahidul Islam Shikhar Rumi, working in this hospital, BIHSGH General Hospital, as an assistant professor in the Department of Hematology since 1st January 2022. Actually, after then, hematology activity started in this hospital formally. Before that, only the laboratory side was working. So today, this is a great moment for ourselves that we can establish a bridging between the abroad international figure as well as with the BADAS authority and his other sectors as well. So you know the BADAS is a big organization serving people, especially he started his journey for the diabetic patient, but now this organization extended his activity in many areas, not only for the patient treatment as well as nursing, medical student and medical college, as well as technology. There is a university, and they are contributing great role in national policy making as well as many research and academic activities. So we are happy and grateful to all of you that all of you are very much busy, but you are sacrificing your time for the benefit of the nation. So with your permission, just like formally introduce with each other. So today's meeting actually preliminary meeting for upcoming 7th November program. We already know that you are coming in our November Hematology Society program. So at that time you are ready to meet with us. So how we can best utilize that time for ourselves. For this reason, actually, we arranged today's meeting. So this venue of this meeting, BIHSGH General Hospital, this is Zoom meeting, and today's chair in my right side, Professor Azad Khan Sir, National Professor Bangladesh, and President Bangladesh Diabetic Association. And BIHSGH General Hospital lead in my left side, Professor Fazlur Rahman, Director General, BIHSGH General Hospital. Another from the BARDEM lead, Professor M.K. Qayyum Chowdhury, Director General BARDEM. Today, actually, he is engaged for another meeting. So this is an apology. Today's international lead and moderator, Royal College of Pathologists, Advisor Bangladesh, Dr. Amin Islam, consultant hematologist, and another participant from the abroad, Dr. Josh Wright, consultant hematologist, Sheffield Teaching Hospital, senior lecturer, President British Society of Hematology. Another from Professor David Roberts, consultant hematologist, Oxford Rockfield Redcliffe Hospital, NHS Foundation Trust, Oxford University, Medical Director, NHS Blood and Transplant. Professor Paul Telfer, consultant hematologist, BARDS, NHS Trust, Queen Mary University, London. From BIHSGH General Hospital, other member or other participant, Dr. Sabrina Rahman, Junior Consultant, female, just left side to me. Department of Transfusion Medicine, BIHSGH General Hospital. Dr. Shahriar Sadek, Chief Consultant, Head, Department of Surgery, BIHSGH General Hospital. He also connected to us. Dr. Ahmed Salam Mir, Associate Professor, Department of Endocrinology, BIHSGH General Hospital. Most probably he will connect later. And from the BARDEM, Professor Dr. Shaukat Hassan, Director, Laboratory Service Division, BARDEM. He will connect. And another Professor Dr. Tasnim Farhana Dipta, Head Transfusion Medicine and Clinical Hematology Department, BARDEM. She also already connected. Dr. Farida Parvin, Assistant Professor, Transfusion Medicine and Clinical Hematology Department, BARDEM. So these all the members today we gather to set up the what and how we can utilize that program in a best possible way. May I request Dr. Amin Islam to conduct today's session? I think it will be easier because you know ourselves as well as you know the foreign delegate. So I'm requesting you to conduct the session. Thank you.
Thank you. Thank you very much, Ruby, for your generous introduction to all of us this morning and this afternoon in Bangladesh. The discussion I had with you and the colleagues in the United Kingdom is about our conference in Bangladesh, which is going to be held 3rd and 4th of November in Sylhet, Transformation of Blood and Blood Cancer Care in Bangladesh. And we are fortunate to have Royal College of Pathologists, United Kingdom, co-leading the program with Sylhet and Usmani Medical College. We took it in Sylhet to decentralize, to take people outside so we can have a quite senior level discussion about how best we can help and integrate and work in what we call a multidisciplinary way. So it's out in the town, outside in the town, in a place where we can just dedicate 2 days, 48 hours to discuss in various sessions. And I'm so grateful that we have about 17 world national leaders in their field, from radiology to thalassemia to transplant, transfusion, next generations cytogenetics, and so on. We have all on board and everybody is coming in. And they are the leaders in their field and the writers of the books as well, as you know. So after the meeting, we're planning to go to Dhaka on 7th, which is Monday. And we're going to subdivide into subgroups. And after discussing with Paul Telfer and David Roberts, we felt that as they had some discussion and the meeting in BARDEM and BADAS, it will be quite useful to one of our group at least should go to BARDEM or BIHS, wherever you prefer, and have a discussion and see how best we can integrate and collaborate in terms of exchanging knowledge, innovation, research, education, and so on. And I get a feeling that you are welcoming them to visit BIHS and also probably the BARDEM and have discussion face to face about how best we can get to know from each other and develop a service for the best outcome of our patient we care for. With all this, I think if I could ask Dave Roberts, if you could kindly share your thoughts, what we can do, obviously, from our perspective from the UK, especially from the NHS blood and transplant sides of things. And obviously, Dipta on the ground can share us what facilities they have and what is the transfusion services in Bangladesh and how it works with the regulatory bodies, etc. I can ask actually Tasnim Farhana Dipta actually to share her views about the transfusion services, and obviously you will know how best you can probably from NHS blood and transplant services can help. I think it will be better if Professor Tasnim Farhana Dipta, if you could just let us know about the facilities you have and what do you think will be useful when Dave Roberts come in and have a meeting with you on the ground. Tasnim Farhana Dipta.
Thank you so much. Assalamu alaikum. In our country, there is legislation on blood and blood transfusion medicine, which is run by Supreme Court, and there is a SRO, that is Supreme Court Ordinance. And that's why there is gazetted order, although it is not 100% fully practiced, but in our country there are three type of division. That is, one is government services, number two is the private university and armed force medical college, and our BARDEM-like services, and also there is some corporate facilities. So there is the variation between the various type of services, and in BARDEM we are willing to update our service and knowledge to actually help the patients with blood and blood diseases in our BARDEM General Hospital. We have transfusion medicine lab, transfusion medicine outdoor, along with hematology outdoor. And we are also serving academic and clinical services. So we hope that with your help and training and updated modern facilities, we can serve. And also we can serve for the stem cell transplant to the benign and malignant hemato-oncological disease support. Although we have no indoor facilities, but we are treating some chronic malignant cases like polycythemia rubra vera or CML or multiple myeloma. After the diagnosis of acute leukemia from our department with the simple bone marrow aspiration, we have to refer it for immunophenotyping and other translocation facilities to the outside, because we have not these facilities in our hospital, and we have lack of hematopathologists in our general laboratory. So we have to seek help from other institutes. So if we can focus on this side, and also we can automate our transfusion services along with panel cell tests like the minor antigens, so we can help our country a lot. I think so. Thank you so much.
Thank you, Deepta. I know the transfusion service, you clearly mentioned about the regulatory authority. We have here MHRA, you have the legislation set up. The transfusion can be challenging, being born in Bangladesh and trained my MBBS in Dhaka. It's not that easy, and transfusion has got risk, and transfusion transmitted infection is also still a problem in our country. And they will tell you that we are so fortunate in National Health and Blood Transplant Services. It's the safest blood in the world. And day before yesterday, I needed about 6 units of O negative blood, and it came in like this. You see. So in Bangladesh, there is a challenge. People still have to rely on the first degree or second degree relative, the related transfusion, and the donor as well. So it is a challenge. Really, the availability of the blood is not as robust as in the UK and other developed world. So Dave Roberts, if you could share your thoughts about, you heard about what we do and you've been there a few times, so how you can help, especially the transfusion services and the automation and the testing, because alloantibody testing is a big problem with the multiple transfused sickle thalassemia patient. MDS and leukemia patient is a problem. And quite frequently we have transfusion reaction, and we really don't know whether this is an antibody mediated or non-antibody mediated. So automation is also a big challenge for our country. So Dave Roberts from University of Oxford.
Well, I mean, thank you very much, and greetings to you all. I mean, thank you for organising this and the conference. But my present role is Medical Director for Pathology in the Blood Service, but I have been the Assistant Medical Director for Blood Donation. And I have worked in scientific and clinical hematology. So I'm very humbled to be here. It is wonderful that you ask for our help, but we are really here to support you develop services, because we can certainly help, but most of the organizational work and also the technical work will have to be, of course, be done in Bangladesh, and our role would be to support you to do that work. So I think the most important thing is to have a shared vision of what we would like to do, and to have enthusiastic, help and knowledgeable help in Bangladesh. I think it will involve a lot of different groups. I mean, obviously, the people on this call, it's wonderful you're here. I think we should be ambitious and look to the future. It took over 30 years for the UK to develop from individual local donation in hospitals to a national service, or a regional service, I should say, and then another 30 years for it to develop into a national service. So the whole process of developing a national service is very worthwhile. I won't go into all the benefits, but it is a long-term aim, and it will need an awful lot of effort. But I'm sure, absolutely sure, Bangladesh will evolve to that. I think our job is to try and do that as quickly and efficiently as possible to help save patient lives. So that's really my first point. I think we have to develop a shared vision. I think in some sense, the easier thing to do is to an absolutely necessary thing to do is to develop, first of all, an understanding, my understanding, and our shared understanding of what transfusion services are provided in Bangladesh. But what we can do relatively quickly, I think, is to help develop technical expertise, because without good technical expertise, it's impossible to join the individual hospital transfusion services and the armed services transfusion services into a national service. And I don't think the blood service has a great deal of money to give, but I think in terms of developing training and helping with equipment, I think we certainly can do that. So when we're in Bangladesh, I think that's something we can explore, what technical help in terms of training we can offer to support, either remotely or to have people come and visit the UK. But what I would turn to in the longer term, and perhaps I'm here, it's really a question of what we can do to develop the national structures for transfusion. So in this country, there's a very clear way in which transfusion services have developed. So the first thing is a clear legal basis to collect and process and issue blood. We do that because to take substances out of people, substance of human origin, needs their consent, and there is a legal basis on which we do that. And obviously it is very simple. It is to provide products for other people, for patients. But there are many requirements, including to make sure that it is done in a safe way, both in terms of processing the blood, but also in terms of testing it, and in terms of issue. And there has to be, therefore, an authority, a separate authority that inspects the places that issue blood. And I feel that the regulatory basis of transfusion is very important to establish, because without that, it's very difficult to really develop national standards and to make sure not just in BARDEM. I'm sure we can develop good practice there and in the general hospital, but throughout Bangladesh, there are high standards and those are inspected. Now, it may be that this is already done, but I would like to, in the time I'm in Bangladesh, to understand how we can reinforce and help that work, help regulators and develop standards for inspection. So there are many other aspects of transfusion, of course, and our blood service has end to end from collection right through to use. It has expertise in all these areas. So I'll just mention, we've talked about the technical side, which is something people always think about in transfusion, but obviously all great testing, all great laboratories is only of limited use if you don't have enough blood to start with. Now, in the UK, we collect about 30 units per 1,000 of population. So we collect over 1 million units a year. And, you know, the interest in donation has been built up over many decades. But it does need really a lot of thought about how that can be built up. I know there have been huge efforts, and I've been in Bangladesh, I've seen volunteers, I've seen drives through voluntary groups, through mosques. But if we have the ambition to provide a sufficient supply of blood for for all the medical, the patients we have now and those that the medical advances in the next 30 years, we really have to engage the government, but many people across Bangladesh in giving blood. I mean, it really requires a huge marketing effort and a national effort. So that's another thing. And again, these are ambitious targets, but I know we can do it. In 50 years, you will have a national service. Our objective is really to do that as quickly as possible. And the final thing is, I think, something that we can do relatively easily in professional groups, and that is to understand the guidelines and to develop guidelines for the use of blood and to make sure it's used appropriately. I'm sure you're aware that the way in which blood use has changed dramatically over the last 20 years, and we use much less blood now. We have lower thresholds for transfusion, and we monitor. I say monitor. We audit. We check the way in which blood is used in hospitals to make sure the blood that we have is used most effectively. And obviously, that's very, very important when there isn't sufficient supply or as much blood as we would like. So I think that's something that's relatively easy to do. So in summary, I think, we need to develop a vision for the future. I think it can be ambitious but realistic, and there are many parts of it. Some of it is the regulatory side, which I'm really trying to learn what goes on. But if there are to be advances in that, it will need a lot of collective effort, not just from the General Hospital and BARDEM, but across the whole, hematology and transfusion hospital sector to ask for better regulation. I think we then can help with all aspects of transfusion, advice on blood donation and collection, certainly technical help and consideration of how we can help you train people and better, optimize techniques and reagents and so on. I know that's an issue. Also better testing of blood. There are some very good papers I've just been reading from Bangladesh about how we could move on from rapid tests to better serology and nucleic acid testing. And finally, guidelines about the use of blood. So it will involve lots of aspects of work, but it does involve it will be able to help individual hospitals, but also it will need a collective effort. And I think that's what I would hope we can get some agreement on, some engagement on when we have our national conference in a few weeks' time. Thanks, Amin. Amin, you're on mute. Sorry, I can't hear you.
Thank you, David. Thank you. Thank you. I think, as you said, that we need to set up a vision and then work as a group. And talking to the BARDEM authorities and also with Tasmin Farhana Ditta, with the transfusion leads, she would like to get some other people from, say, 2 other institutes, probably the Department of Health and also the tertiary, the Bangabandhu Sheikh Mujib Medical University transfusion department leads together and see how collectively we can work together and come up with an agreement, as you say, and then work afterwards. And certainly, as you say, from some people from the BARDEM or the BIHSGH, probably we can bring in 1 or 2, like Dr. Bhumi came in, and learn about the guidelines, protocol, reagent, machine, and technology, etc. here, and then go back and obviously try to implement one by one. It will take a number of years, as you say, but there are a few things we can do immediately. There are lots of lack of still awareness about the first degree relative donation. Unfortunately, a newly married with postpartum hemorrhage has been given brother's blood and had very unfortunate situation with transfusion transmitted graft versus host disease with fatal outcome, as you know. So it still happens, and it is a common practice to give first degree relative blood without irradiation. I know, I'm aware that we can still give it, but the irradiation is a big thing. Even some transplant patients, they don't get the irradiated blood. So there are lots of awareness program amongst the population, as you say, the moms and the leaders, and as well as the healthcare providers even, is needed. So we can do all that. So thank you very much for your thoughts. At this stage, I will invite Professor Paul Telfer from BARDEM, Queen Mary University of London, to share your thoughts about the thalassemia. As you look after so many Bengali patients in Whitechapel in Royal London, you diagnose here in the UK, and some of them, they come from Bangladesh, and you're looking after them for a number of years now, and you have experience delivering lectures in the Department of Health, visiting various tertiary facilities, BARDEM, IPGMR, both BSMMU and Dhaka Medical College. So, Professor Paul Telfer, your thoughts and suggestions, please.
Thanks, Amin. Can you hear me okay?
Yes, we can.
Good. So thanks very much for inviting me to this meeting and for organising the event in November, Amin. And it's nice to see our Bangladeshi colleagues online here. As you say, I've had quite a lot of involvement with, particularly with regard to thalassemia care in Bangladesh. And just to kind of give a bit of background, we had a small grant from Queen Mary University of London to run a pilot project around thalassemia diagnosis, working with the National Institute of Laboratory Medicine and Research in Dhaka, and that project has got a little bit more funding, so we've been doing some collaboration there, and we've also had 1 or 2 discussions and meetings with the Ministry of Health about going forward in the future, because thalassemia education, awareness, prevention and treatment is on the National Healthcare Plan, and if we could help in advising and collaborating in developing that project in Bangladesh, that would be great. So I work in East London, and I've been managing thalassemia children and adults in Whitechapel for about 25 years now. And as you say, I'm in about maybe 50% of my patients are Bangladeshi, and there are many, many similarities, I think, in the way that thalassemia affects patients and their families here and in Bangladesh. And so I think there's some shared experience there. So I think that there's quite a lot of potential to develop all aspects within thalassemia, which is quite a big public health issue in Bangladesh. And I think it starts with public education. It involves developing laboratory networks so that accurate and quality assured diagnoses of thalassemia carriers and thalassemia cases can be done. And then having some preventive strategies. It's not quite clear what would be most appropriate in Bangladesh at the moment, but that's an area of discussion. And the treatment, which is done very well in certain clinics that I'm aware of in Dhaka, but we would like to sort of help to kind of develop a more kind of countrywide network of thalassemia expertise for treating children and adults with thalassemia. And possibly in the longer term, some of the novel treatments that are being developed that may in the future be applicable in Bangladesh, even treatments like gene therapy. It would be interesting to explore how those could eventually be used in Bangladesh. And together with that, some kind of research program looking at the disease as it affects the Bangladeshi population, the kind of disease modifiers, that sort of thing. There's quite a lot that could potentially be done. I don't know whether that helps, Amin. Is that
very helpful? And with your experience looking after the half of your patients, as you say, from Bangladesh, so you have a very good shared experience. And as you say, there is a potential of gene therapy as well, and particularly in Bangladesh, more since research about E-beta thalassemia. And most of our the thalassemia needing transfusion E-beta thal, and there are lots of genotype phenotype variability as well. And there are lots of patients unnecessarily get transfusion and transfusion-associated problems, which easily can be avoided. Surprisingly, the last week, after giving hydroxycarbamide by one of the doctors to the E-beta thal patient, she is 21, and they repeated the blood a week after. The hemoglobin went from 78 to 98. And the relative disbelief is, they say it's wrong, because all these years she's having transfusion. There are lots of things you see. People are not aware of how easily you can avoid transfusion and give hydroxycarbamide, for example. But certainly this was the case of this index patient I was involved last week. And there are lots of other, as you know. So I think your experience, UK and in Bangladesh, I think we can do a lot and in a better and the comprehensive and integrated way. And you've been to Dhaka Children's Hospital as well. You have visited their thalassemia unit, the largest unit there with Wakar Khan and so on. So I think we certainly value your expertise, and we will be grateful if we can work together while in Dhaka. And obviously, when we come back as a group, I think we should work together as a team to improve the service and improve the prognosis and the life expectancy of our patients. We was surprised to see one of your patients, Paul, 65 years old lady with HBSS disease. She was admitted under myself 2 weeks ago. She is 66 years old, 64 years old. The sickle cell, she's telling me if I was in Nigeria, I would have died about 50 years ago. So how the transfusion and the chelation can improve the life expectancy. We see it every day. And when I was a trainee with you in Royal London, both pediatrics and the adult, I have seen so many amazing stuff you've been doing for decades. So thank you very much for coming along.
One thing
Yeah.
I want to
helping our nationals.
Dr. Amin, I want to say one thing, if you give me permission. One thing,
Yes.
especially for the foreign guests, actually they are staying in that place, whole world actually in front of them, developed countries, middle income countries, and the low income countries as well. So BADAS actually is a big organization, largest organization, just after the government sector actually. They have so many centers distributed in the Bangladesh. So in our country, actually, scenario corporate level working well, but they decorated their service facility only to generate actually money. But the BADAS like organization, they are non-profit organization, and when you visit, you can observe that so many service we can start or we can develop without investing any further investment actually. So if you discuss this kind of issue that your logistics support are now capable to do this kind of activity, it will be a great help for us. Another thing, in our country, there is a thinking that if we develop expert person, especially the doctors, service will develop. Actually, doctor never give the whole service. With this doctor, nursing sectors and the technical sectors needs to be developed as well. So if you focus this issue, that if you don't make this supportive agent or sectors, they will not give proper service to the community. Another important, I want to mention that in our country, there is a scenario that every hospital trying to develop all the facilities in his or their institution actually. But low economic country, this is not possible to develop all the service in one hospital actually. So we should make some collaboration or outsourcing system, proper channel, then we can give actually proper service to the community. So if you consider this issue and if you give some example or focus in upcoming traveling, I think it will be easier to our authority to reshuffle or reorganize the service capacity in BADAS, BIRDEM, as well as BIHSGH hospital. Thank you.
Yes, thank you, Romeo. We understand what you're trying to say, that, and certainly we have a change of hospital. Yeah, Paul.
I just wanted to make just two other points. One is that we work quite closely with the Thalassemia International Federation, which is the international medical and patient group around thalassemia. So I think that they are integrated into the efforts as well. Just to clarify that. A second thing is that certainly my institution, Queen Mary University of London, I think is potentially interested in sort of helping to develop educational materials that would maybe be useful in Bangladesh, around, for instance, around thalassemia care. And possibly, I hesitate a little bit, but possibly collaborating in sort of research degrees, and people in Bangladesh who want to sort of do PhDs. We've been thinking about that. That would not be easy, but it's something that we can certainly look into a bit more.
Yeah, thank you, Paul. Professor Azad Khan, the chair of the BADAS, and the national professor, he is here, and certainly, as you do supervise the PhD student in the Queen Mary University, there will be quite good opportunities for some potential candidate probably to apply for a grant, for example, to do a PhD encompassing thalassemia and so on, and we can have this discussion. Thank you very much for flagging this as well. As you know, the BADAS is the second largest healthcare provider in the country after the government sectors, and they have chains of hospitals all over the country as well. From cardiac to neurosurgeon to now cancer, there is the potential of the BADAS Cancer Hospital as well. And diabetes is the main specialty, and now branched out in all the specialty of medicine and surgery and gynecology and so on. So when we're there physically, hopefully we can explore further options and opportunities, how best we can integrate. With this, I think we will now ask Professor Fazlur Rahman sir from the Bangladesh Institute of Health Science. I was going to ask the diagnostic head from the BARDEM to discuss the potentials of the working in hematology diagnostics, NGS, and so on. I don't see Professor Shaukat Hussain, the director of the Laboratory Service Division. Sir, if you are connected, then we would love to hear from you.
Shaukat here?
No, sir, he is not connected.
Okay, that's fine. That's fine. We will go to Professor Fazlur Rahman sir from the BIHSGH General Hospital about your thought and how best we can work together. Sir.
Professor Azad Khan is trying to say.
What I would like to say that we have the network which can easily be used for countrywide survey or countrywide detection. Detection of carriers. It's easy to detect full-blown disease, but we'll be able to detect the carriers countrywide.
Yes, sir. I forgot to mention this. So we have Dave Roberts and Prof. Telfer that we have countrywide network under the BADAS authorities and the hospital network, and we can detect remotely as well. You see, and there is a way we can transport the sample to our lab in the BARDEM as well. So it is in place, and we can easily utilize these facilities while on the ground, and we'll explore that further. Professor Fazlur Rahman sir, your thoughts about the process at the meeting?
Actually, I joined BIHSGH General Hospital around 2.5 years ago. Before 2 years, actually, there was provision of only whole blood transfusion, but now we have arranged the components. Like we have stopped transfusing whole blood by notification, and we are now transfusing either RCC or platelets or fresh frozen plasma, etc., cryoprecipitate, etc. We are actually now, transfusing these components, and also we are discouraging transfusion as a whole unless it is very much needed. We hold a meeting with our consultants that do not transfuse unnecessarily, otherwise, unless it is absolutely needed. This is about transfusion, and we are trying to develop our lab, but as our Dr. Rumi was saying that we need to develop the paramedics and the technical people apart from our doctors, etc. And we are trying to do this, and our future aim is to develop the factors, especially there are many hemophilia patients, so we need to develop these factors. So possibly in next few months, we are going to take certain measures to procure equipments to isolate these factors, etc. And regarding thalassemia, which was the last topic, as our President of National Professor Azad Khan was saying that we are utilizing our network. We don't have any, this electrophoresis machine. We send our patients to our Apex Hospital BARDEM, and we get the report from that the BARDEM hospital, and we have a wide network, and we use this network, that is everywhere in our network where there is a suspicious patient for thalassemia. They send the sample to BARDEM hospital, get the result, and treat them accordingly. So this is now our position, but still we are waiting for your coming on 7th of November, and we'll be talking then at that time how we can further improve the system, how we can further utilize our chain, and how we can develop our own facilities so that we can give more, more appropriate service, especially in context of blood transfusion, in context of thalassemia, and also in context of combating this hematological malignancies like leukemia, lymphoma, or other malignancies. We are trying to improve ourselves so that we can develop these facilities. So we are waiting for your coming, and we'll be discussing further about these issues. Thank you.
Most probably, Dr. Amin, you are mute, most probably. Please unmute yourself.
So thank you, Professor Fazlur Rahman sir. Thank you. I know the amazing work you've been doing. And within a short period of time in hematology, if we take it as a snapshot, along with so many other the service you provide, it's a great achievement actually doing the FRSCs and producing cryoprecipitate. Bangladesh didn't have cryoprecipitate before 2012, as you probably know, and a bleed hemophilia used to get whole blood, but now we have all these facilities, and you're now trying to produce the factor as well. So it's a great achievement with all these hurdles and you are trying to overcome. And we are grateful that we came together and we have the leading authorities take over, Professor Telfer and Professor Azad Khan sir on the ground. With all this, I'm sure we will talk when we are out there. I would like to invite Professor Azad Khan sir to make your final comment, sir. Professor Azad Khan sir.
As you said, that we are prepared to develop hematological services state of the art within our means. One thing we can really contribute to the population as a whole for doing anything which needs to be done at community level. At community level, maybe that we will be able to do it better than even government. The government network doesn't really function. They function individually, although they can, but it does for many reasons doesn't function. But we are doing this community work through networks, and we are improving on that even more and more and more. Like thalassemia is a classic example that needs to create a program, nationwide program, and we will be able to contribute greatly to it. And we are prepared to do it, we're interested to do it. And as I have said to Rumi, to give a plan that within that means, so we can there will be ample space there. There will be no problem of space. The hospital where we are sitting now is under construction, and actually virtually whatever amount of space you can utilize, that can be created. That's no problem, because his floor is 22,000 now. Yeah. And is only how many stories now?
Now 6 stories.
6 stories.
5 stories
completed, 1 hour.
And then 2 more will be built soon. So this is now 5 stories. 6 stories are being built. Yes. Another 2 will be built soon. We have fund for that. So space, so no problem. As a clinician, I am not in line, you see, because I'm not. I qualified as a doctor. I'm telling people who are here, I qualified as a doctor in 1965. So that must have been a long time back. And then I trained in gastroenterology in Oxford. That was from 72 to 77. Then hospital was in on the Woodstock Road. That's given Thomas. Which is now moved to Eddington.
Actually, Professor Amin, complementing to Azad Khan sir, actually, we don't have any neutropenic zone. We as per need, and when Dr. Rumi got patients, we developed certain improvised or customized zone for that time or for that patient. For the last 2 months, the hospital is flooded with the dengue patients. So we are having now no space for other patients. So we can't provide that spatial area. For that reason, for the last 2 months, we could not serve this the lymphoma or leukemia patients because we could not have that area. But
No,
sir,
I may interrupt you. Don't mind.
sir,
So we can always allocate.
see,
No,
yes, sir.
we should not be used for another.
Exactly, sir.
That should be
We must do it.
because like dengue or dengue, whatever you call. You see, we cannot look after the whole dengue of the country.
Yes, sir.
So in any case, there will be shortage. So we limit it. That this we can accommodate only after this dengue. And disease like this, acute infectious disease like that.
Yeah.
It is the responsibility of the government.
Yeah.
We can only helping. But this
I think what
long-term program, if we allocate
Certain area.
certain area and restrict that, this area will be used for that.
Exactly, sir. Exactly.
That
So
will-
Dr. Rumi should make a plan and we will execute that.
Now, I have already told you that that will be the fund limit that within my capacity I will be able to allocate that amount of.
Yeah, thank you very much, sir. As you said that, I think what is important from the physicians and the surgeons and the colleagues on the ground. For example, I give an example if I am a doctor in the BIHSGH General Hospital, a surgeon, for example, and I have a complicated intra-abdominal obstruction and diffuse large B-cell lymphoma, probably I will be hesitant this well of patient to be treated in this facility. And as you know, because it's a semi-government, private, or whatever you call it in Bangladesh, people will say, which is the best hospital, where they have dedicated bed and ward and the support, etc. And this is what happening, I see, in your hospital even. Patients are going outside. So to attract those patients, build up the confidence among the physician, surgeon, and the population, we have to have a facility. Dr. Kalpar, me, and everybody else, you see, we have infusion unit, we have inpatient, we have outpatient facilities. And I know it is the beginning, you started with the outpatient, and I think the time has come. Rumi now need to identify that you need certain number of beds, for example, not necessarily just neutropenia. You can have 2 side room for neutropenia, but you need to have certain beds, you see, probably 5 beds you need. Mamin Chandi, who is the founder of the stem cell transplantation in India. I was with him about 5 years ago, and he was telling me in CMC, he was sitting on a little corner room and he himself was doing bone marrow and everything else together and keeping patients under medical ward, you see, 1 or 2 and 3. And you see now, the India is the forerunner of stem cell transplant, CAR T cell, and you know it, NGS and everything. So you have started a good start, and I think you need to now move on and give plan to Azad Khan sir and the Rahman sir and the authority, and I'm pretty sure they will provide you facility. And we all are here. We know how dedicated the BARDEM and the BADAS authorities are. It's an affordable healthcare strategy with a very limited amount of fees. Patients are getting amazing treatment. And I hear all the time, there was one relative of mine had 16 years ago, he had a cardiac bypass surgery with very small amount of money, 60,000 taka, which is 400 pounds. He's still alive, very fit, this guy, riding motorbikes. So these are the amazing things you are doing on the ground. And this is one of the small specialty in hematology, along with what you do, all the others. And I'm pretty sure with all of help from the ground and from the world leading experts coming together, we should be able to do better and better every day. But you're doing a fascinating job, no doubt about it. Thank you. Thank you.
for today's meeting, we selected 5 agenda. I think 4 already discussed. The 4th number, program schedule and time slot, this issue pending. Should we discuss now or it will be decided later?
Yeah, I think with now Professor Dave Roberts, both helper with the you clinician on the ground, I think you can decide about how you're going to do. And I will be in Dhaka as well, and I'm very happy to come along and from hematology service perspective, not only transfusion and thalassemia, I can give you an overview, 15 minutes about the hematology diagnostic service, a little bit of transfusion and everything else as well. And the data from the transfusion sides and the poll helper from thalassemia sides of things. So we can decide that later, and I'm very happy to propose an agenda for the meeting within the next couple of days and share with you and data.
Last one thing, we actually now observing the developed country service, but we should think that 50 or 60 years ago, actually in which situation they started their service. So we are now actually in that situation that we are starting from zero or near to zero. So we should not give up the hope actually. If we start today, I think they reach at this point by 60 years, we can reach by 30 years. But we should start with big hope, should not give up the hope.
Yeah, Dr. Rumi, I think you will be probably wrong to say we're starting from zero. I qualified as a doctor in '97, and what I see today with all the hard work of these professors sitting right and left, you see, relentless work they are doing on the ground, and it is so much better now. We do not compare with other systems. As Dave said, it took 50 years to get the national blood and transplant services. It wasn't like this. And what Bangladesh and you on the ground have achieved is enormous, actually. And I have to say, Professor Azad Khan sir, who did a PhD in the University of Oxford, probably I was not born then. And he went back, and what he has done for the nation is just amazing. And we appreciate his help for the country and for the population as a whole. And we are ever grateful to him and to Guru Mansar and so on as well. And we're very happy. And being Bangladeshi, I always think about you, see, trying to collaborate and communicate and see you on the ground always. And we together, you know, we will do much, much better. And Bangladesh is not zero. I think it's about 60%, 70%. In some aspect, is even much more. You will be surprised if you sit in a cardiac meeting. I do sit in various meetings, not only hematology, you see. And the world leaders cardiologists say Bangladeshi cardiology service and cardiothoracic is far better than many other Southeast and African countries as well. And the outcome is so much better. And thank you for all of this. Thank you.
So may I request to conclude this session to Azad Khan sir, and I'm giving thanks to all.
No, I think we just concluded. So I think what in the view of the discussion, we should sit together and see what we can do, and then we propose it. And for me, also for me, I mean, it's really on behalf of Practication, I am truly grateful to you for your time and for your help us, and also the other British consultant, Dr. Wright, and Professor Roberts, for your time and commitment. Thank you.
Thank you very much, sir. Thank you, Dave Roberts. Thank you, Paul Telfar. Thank you, Roman sir. Thank you, Azad Khan sir, and all the other faculties and the members connected virtually this morning and this afternoon. Dave Roberts, if you have anything to say as a concluding remark.
Yeah, well, I mean, thank you very much for organising this. Perhaps I can follow up by email with you to start some discussions before the meeting in Sylhet, which would help me focus my talk really. So Obviously, I want to mention things that you find useful. And although we've talked about board visions, to reassure you, I think we should start with helping individual hospital units, because without that expertise, you can't develop more bigger structures. Because what happened in the UK was that the hospitals that had advanced transfusion services really were the nucleus of the regional services and then the national service. So it all grows out of having good local expertise, good local practice. So they run in parallel, development of big scale things and development of hospital services. Okay.
Thank you very much, David Roberts from University of Oxford. Thank you all.
Thanks.
So thank you, everybody.
Thank you, sir. Thank you. All the best.